Morning. How about that? Oh, that was so cool. I wasn't really expecting a reply, but that was excellent. If you want to go ahead and grab a seat, we tried to make the tables so that there were chairs only around half of them. So if you would like to try to move around, squeeze together so everyone has a good view, feel free to help yourself and certainly make yourself comfortable as we're going to be together quite an amount of time today, a full day, and we're looking forward to being with you. My name is Charla Long. I'm with Lipscomb University's College of Professional Studies, and as Joanne Polis likes to say, I serve as the Dean for the Collaboration College effort this year. One good thing you should know is that I always start on time, and I always end on time, and so if you look at your clock, it's straight up 8:31 because I did start at 8:30, which means you can take a great deal of confidence that when we say we'll be done by 3:30, we truly mean we'll be done by 3:30. It may not be 3:29, and it definitely will not be 3:31, but we will honor our commitments to be timely and to really respect the commitments that you have in your life as well. So on behalf of Lipscomb University and Linda Peak Schacht, who is the founding executive director of the Andrews Institute for Civic Leadership, we welcome you to Collaboration College 2.0. How many of you participated in what was 2011? We did the original Collaboration College, convening just like this. Oh, it warms our heart. Look at that, Joanne. Isn't that exciting? They came back. I don't know what that means, if that's a good thing or not, but we are delighted to have you back for Collaboration College 2.0, and today what we call Collaboration College 101. So if you think about going back to college, and we'll spend some time talking about this at 9:30 today, when you think about going back to college, you have that basic class, those freshman level classes, and the sophomore and junior and senior. The structure of this year's endeavor is very similar in its design. So today is kind of that freshman level primer on collective impact and also around collaboration. And so we hope this will be a very robust day of learning for you. I'd like to think from the logistical support side of the house, Caitlin Nozit. I want to say knows it, but that's not nice, is it? Does she knows it? She knows it a lot. Knows it. Is she in here or she step outside? Both Caitlin, thank you, from the HCA Foundation has done an outstanding job, and Jadid Manharis, who works for me in the College of Professional Studies and my entire team. I really appreciate their help in pulling today off, so thank you, Caitlin and Jadid, for that. Collaboration College is a collaboration. It's a number of organizations that have come together to try to help support efforts around the common good in this community and how we can build that. And I am delighted to have the opportunity to partner with the HCA Foundation in this endeavor. For everyone in this room, I know you know Joanne Polis, but Joanne is certainly one of those women that I greatly admire and respect. If you look at the community change that has happened in Nashville, much of that is community change that crossed her desk in the form of proposal for funding. And Joanne's vision and ability to see the future and what could exist if we could all work together in a more powerful way, if we can move towards collective impact and making a true difference in this community, that's being driven by Joanne, and we are delighted to partner with her. So let me introduce, and you can join me in thanking her and welcoming her, Joanne Polis.
Thank you so much, Dean Charla. She, partnering with Lipscomb was really very intentional. And to tell you the true story, Lipscomb really came to the HCA Foundation probably 4 years ago now and said, we did one session on collaboration and we'd like to do another one just like it. And that was the seed for Collaboration College, because we started talking about, well, yes, we could do a one-day session on collaboration and everybody would come and they'd learn something and they might take something back to their organizations. But I said, to really move the needle, I think we've got to go deeper. And we've got to ask for more of a commitment from the participants. We have to offer more to the participants. And then we have to see where that takes us. So we did that, and many of you were involved in that. And then we took some time after we celebrated the recipient organization, which you'll hear from today, because what we want to bring to you today are models not only of local success and collaboration, but we're also going to bring you some models outside of Nashville. Because while we're the IT city, right, everybody loves being the IT city, we know we can learn something from other cities as well. So the other thing about collaboration is that it really is greater than the sum of the individual members, because it's greater than the sum of the parts, and each member brings something unique to the table. So as a demonstration of that, I'm going to introduce some of the folks that were involved in planning today and on the planning committee. So last time we were the only foundation involved, and what we realized very quickly is that it would be better if other foundations were involved. And you know, we as foundations had been speaking the language of collaboration for a while, but we felt like we needed to actually model it a little bit more often. And so I'm very, very pleased to have a Baptist Healing Trust join us. Baptist Healing has expertise in funding programs and helping them have very compassionate care to the individuals that they serve. And Baptist Healing also has wonderful new expertise in collective impact, and you'll hear a little bit more about that today as well. So from Baptist here today are Kathy Self and Kristen Keeley Dinger. Will you stand, please? Now, you can invite nonprofits to the table without inviting the Home for Nonprofits and benefiting from the best practices and expertise from the Center for Nonprofit Management. So from the center, Louis Levine will be, we hope, here later today. I'll let you he'll let him tell his story when he comes here. But we're happy to have Kim Carpenter Drake here today. And Kim, would you stand? And if you want to follow, this is in your wonderful guide, also produced for us by Lipscomb University. This is on page 15. Now the next partner I want to introduce is an example of one of our consulting partners. And I don't know, it's C3 Consulting. And I don't know if Ryan or Paul are here yet. So you will meet both of them this afternoon. We did allow our consulting partners, you'll meet them at the point in the agenda where we're going to talk about kind of the role that they're going to play. Next is, and you've met Charlotte, you've met Linda, and Jadid. And now I also want to introduce Rebecca and Jeff from North Highland. And North Highland, along with C3, along with HCA, is another consulting partner. And those are individuals that if you choose to become a sophomore and come back to the next class with your partners ready to do collective impact or collaboration, you will get the benefit of some in-kind consulting from one of the top consulting firms in Tennessee, and I would say in the region. And they're so good that we at HCA Corporation use them as well. So if it's good enough for HCA, we hope it's good enough for you. And we'll look forward, because that really, to me, was one of the differentiators of Collaboration College 1.0. Really did move the needle, really helped organizations collectively think more outside the box. So Rebecca and Jeff, would you stand? And also from HCA is Karen Thompson. And Karen Thompson is within our internal consulting group at HCA called the Strategic Resource Group. So Karen, when you met Karen last time, she was in the Strategic Resource Group at HCA, but since that time, she's actually joined our foundation board. So thank you, Karen, for wearing the many hats that you're wearing today. And last but absolutely not least, you did meet Caitlin, who can do all things, and really has served as one of the project managers for the group. But this also comes together with Lois Abrams from the HCA Foundation. And Lois, would you stand? Lois is our grants manager and has been with us since the beginning. So I don't think I missed anyone. And kind of why I went through that, while it took, and I'm trying to be attentive to Charlotte keeping us on time, it's an example of, as you look at your collaborations today, think a little bit outside the box. And one of the ways, and continually ask yourself, do we have the right people at the table? Should we maybe think a little bit farther, a little bit more outside our normal realm? So one of the ways that I'm happy to say that we're starting to do that as well, and this is a differentiator from Collaboration College 1.0, is we want you to think about business and we want you to think about government. And so on thinking about government, we are very excited to have Christine Lalonde from the Mayor's Office of Innovation here today. And Christine is working within the Mayor's Office, within all the departments, to help them look at collective impact and look at collaboration. So Christine, would you stand, and you'll hear from her later today. So today's a day, as Stephen Covey would say, to kind of sit back, relax, sharpen the saw, and I'm going to give you one more challenge, and that's ask the tough questions, okay? You know, that Southern polite thing that we do, and we just listen, and we say, oh, how wonderful. I want you to kind of go beyond that, dig into your more non-Southern roots, if you have them, and think about those kind of hard questions, because the panelists and the groups that we've assembled from you here today, you know, did go through the joys and the challenges of collaboration. And collaboration is complex, it's hard, and as you'll hear from the next group in a little bit, you know, you really, there are lessons to be learned. There were lessons to be learned with Collaboration College 1.0, and there are lessons learned from the groups that participated, and I hope you will challenge some of the speakers to say, maybe, what was the most difficult thing about what you did? Or what's one thing you would do differently? So think about those kinds of questions as we hopefully have a great day with a lot of interaction and not just speaking. So thanks for taking this day to sharpen your saw, and I think I'd do it back to Charlotte. Or let me check the agenda and then I'll know what I'm doing. Is it Michael McSurdy? Yes, okay, so it is the winning practice in collaboration. So we did want to share with you the one practice on collaboration that we acknowledged at the Salute to Excellence. And what's interesting about this collaboration is that it resulted in a lot more than they had originally intended. So listen with those ears. I mean, you'll see what you read about, but I want you to look at the deeper engagement of those four agencies. What they have in common is serving families in Middle Tennessee. But they were not like four very similar agencies that came together. They were really four unique agencies that discovered a way to provide behavioral health services that would require a shared approach. So with that, you can read about Michael McSurdy in your book, but Michael was one of the leaders of this collaboration. Michael is the CEO of Family and Children's Services, which I hope you all are familiar with, because it's one of the agencies that really is a difference maker for family and children in our community. And with that, Michael's going to introduce his group. And you want to come?
All right. Thanks, Joanne, and thanks, Charla, and everybody else. I'm excited to be here. This is the second time publicly I've gotten to talk about Collaboration College. Birmingham copied Nashville and did one, and I was asked to go down and talk about our process there. And the PowerPoint you guys are going to see today is version 3 or 4 of the original PowerPoint that, thank you, that we put together for Collaboration College, and you'll be getting information about that. So I think it's always good to know that the things you're asked to do, you might actually get to use again. And members of the team have also taken it and used it for other things that they've done, because this has gotten pretty effective for us. So first, let me introduce the folks who are part of the group. Tara, do you want to go first?
Sure. I'm Tara Lentz. I'm the Director of Programs at Conexion Americas.
I'm Christine Jackson. I'm the Chief Program Officer at Martha O'Brien.
And I'm Vicki Beaver, and I'm the Executive Director of Nurses for Newborns of Tennessee.
All right, and they're gonna tell a little bit more about their agencies in just a minute. one of the things that happened was when I was sitting here, I didn't have a plan when I came to Collaboration 1.0 a little over 2.5 years ago. And I had just started at Family and Children's Service, but one of the things I was very overwhelmed by was we were being called a whole lot to, could we come and provide counseling services for people? And that's certainly what our mission is, but we had to figure out a way to do that beyond just, kind of carpetbagging, coming in and placing somebody there. So I kind of put it off, showed up at this meeting. A lot of the folks who talked to me all along were here, and that got us going. But we were really committed to the notion that it had to go deeper than how do you co-locate somebody. That happens all the time. Sometimes it works, sometimes it doesn't work. I think there are reasons it doesn't work, and I definitely think there are reasons that it can work, and we'll talk some about that today. So to get us started, one of the things we did was we looked around the room, and we were all talking about needs of families, and very disparate, different families in different parts of the city experiencing different needs. Had some things in common that we'll talk about. But we started talking a little bit about ourselves, and we realized that collectively there were things that made each of us very different that would make us all collectively much stronger. And so that kind of took us to putting together what our model was. Where do I do this? Okay. Which our model is, and Joanne mentioned this, that the sum is greater than the parts. So I'll let Tara start with talking a little bit about Conexión and what specifically it brought to the table in this process.
Thanks. So Conexión Americas was founded in 2002 to help meet the needs of our community's growing Latino population. Today, we help Latino families buy houses, start businesses, pay taxes, improve their English, and learn how to advocate for and support their kids in the school system. For the past 2 years, we've led the collaborative work that happens at Casa Azafrán, which is a community center on Nolensville Road that brings together 10 different organizations that work with immigrant and refugee families. When we came to the Collaboration for Family Support, we brought a strong track record of advocacy at the local, state, and federal levels, as well as an ability to provide cultural competency trainings and services for other organizations that didn't have quite as much experience working with immigrant and refugee families as we've had. But we also knew that there was a lot that we could learn from our collaborative partners, and in particular, whenever we started Collaboration College, we were getting ready for our move to Casa Azafrán, and so we knew that there was a lot that we could learn from an organization like Martha O'Brien, who's been in a particular neighborhood, serving the families in particular zip codes for much, much longer than we have.
Some of you may not know how Martha O'Brien got started, so I'm going to take you there by telling you that over 120 years ago, Miss Martha O'Brien looked out into the community, especially along the Cumberland Riverbank, and saw families, particularly women and children, suffering, living in conditions that just were unbearable. And so she took her wagon and blankets and food and simply began her ministry to those families. Now, pretty soon she realized that she alone would not do the trick. So she went to the Gleaners, and soon there was a settlement house over near Joe Johnson. Back when Casey Place was being built in the late 40s, the ministry, the Presbyterian churches decided that they would move the ministry into the heart of Casey Place, and we have been there ever since, serving that community. What has happened, though, during my time, the 20 years that I have been there, is that ministry has grown. It has moved not just there in Casey Place, but really we serve people all over Davidson County. The challenges that our families face today are a poverty of choices. They're right on par with those families there on the riverbank. And so we are honoring Miss Martha's legacy by responding to that with a continuum of services that span from cradle to college to careers. These are programs and services that are data-driven, evidence-based, and at the very bottom of it, on which everything else sits, is a fellowship or a relationship. That has to happen first, and I think that's part of the reason why we as a collaboration have done so well, because we feel that same way. We expect to serve some 9,000 individuals this coming year with employment and education as our major focus. We see it when we have our parenting programs, our early childhood programs, youth programs, and community outreach. We want our families to have a choice. And because of that, we even took steps to enter the charter world and establish a charter school, East End Prep, with another one to start in 2015, Explore Community School. When we came to the first meeting, one of the things that I talked about was something that we had adopted at the center called the Brazelton Touch Points. And in a very bold move, I'm not that bold, I said, I need everybody to get on board with Brazelton. And this group said, okay, we can do that. It's important that we have a clear, common voice if we're going to be serving families as they move from agency to agency. Having said all of that, what we recognize, like Ms. Martha, is that no one agency has all the answers for families with all of these needs. And so when we have a family, a mom, who has this newborn and is struggling, we turn to Nurses for Newborn in Vicki Beaver.
Nurses for Newborn started in 2001, and we are a prevention-based agency. We employ RNs that go into the homes of families that are at risk. And in particular, our focus is on medically fragile babies, those babies that are born premature, those babies that are born with congenital anomalies or health issues. And our growing population is our mothers who have health and or mental health conditions. And so when we initially started talking, we were talking about needing counseling. That was a growing need. But it became much more. Nurses for Newborns, when we go into the home, our nurses do health assessments, screenings, connecting people to needed resources. What we realized is that we had that health component and that expertise so that our partners could call and say, we have a family with this health, help us know what is the right resource, or, is this something we need to be concerned with? But we're a new agency, and those of you that are with nonprofits realize that there's a growth pattern. As an executive, this was my first nonprofit. And to be able to go to partners like Connexion, who are also new, and saying, are you having similar problems? Or to be able to go with agencies like Martha O'Brien and Family and Children's, which are 100 years old and have probably done several life cycles of a nonprofit, and say, hey, tell me, how would you deal with this? It was a richness that I cannot tell you how much I value, that it made a great difference. Kind of the underlying with that is that we all deal with families that are isolated. Our families are isolated because of health. They have a premature baby that doesn't need to get out in the public, or a mom whose mental health doesn't let her get out. And the fact that we can go there makes the difference. And the fact that we can connect with other agencies and bring some of those to them, to our families in need. And we serve 6 counties in Middle Tennessee and a little over 600 families a year. So we have a fair number of folks that need help. So this has been an invaluable experience and opportunity for our families, clearly, but I would also say for our staff and our agency.
All right, and then Family and Children's. What we were bringing to the table was a real focus on trauma-informed care, and understanding that the experiences that our families have, what they bring to the table, really affects not just how they are with us, but the decisions that they make in their life or what they can see as possible. Trauma really clouds that for folks. And then also a rigor around evidence-based practice and being able to talk well about what you do and why. And then we have just a huge resource and depth around information and referral, both around healthcare, because we are the coordinating agency around the Affordable Care Act and Health Assist programs, but then also with 211 and the crisis line. So we have a strong foundation that we could lend to the other agencies. So what we realized was we had an opportunity to better meet. We were all doing a good job at meeting the needs of just our families, but we also saw holes. And we saw those holes particularly in families who were the most isolated, either because of health issues, because of cultural issues, geography, or poverty. Those were the things that were getting in the way for our families. They couldn't overcome that. So how do we make sure that we are able to better understand them? We tried to attack that from the training perspective, looking at what each of us bring, and then how do we better meet their needs by just helping them at the emotional and behavioral health level, which was really where why folks were coming to us anyway, to say, okay, how can we provide that service, but do it in a better way than just taking a referral? Because we really wanted to get beyond that fairly simplistic approach. Okay, so we had a great opportunity around shared operations and practice. What we wanted was we didn't want everybody to need to develop a counseling program. We also didn't want everybody to need to develop a training program. We had a volunteer training intern coordinator. We have 30 interns every semester at the agency. So we had the breadth to do that. We had the training knowledge across us. And then we had the clinical supervisory staff. So really all we needed to figure out to do was how to provide the counseling component for these agencies. And so those were kind of our challenges, the development of training and then the development and the kind of rooting of clinical services in each other's program. We were then going to be able to co-locate therapists, like I said, do the joint training, but we needed to figure out what that would look like, because the models that we came together and we talked about the fact that we'd all been part of things that hadn't really worked very well. So we wanted to figure that out, and that's where your work with your consultants can be really helpful, is helping you tease through those levels. And it's a lot of spending time together. We spent much more time together through the collaboration college process, honestly, than we have moving forward. Moving forward, our staff have been doing things together and we've been doing training together. But this group being together was really during the collaboration college process. Okay, so our shared model was built kind of on the core things that Vicki and Christine and Tara talked about, was that families are experts, that we want to work with the whole family, that we wanted to use tried and proven practice, that trauma and loss impact everything that people do. We wanted to make sure we were being culturally astute. That was an absolute for us. And this was the biggest key. We had to get to the place where there was really no turf, that it wasn't a threat if a competency were being developed over here. That was just going to make the community stronger. And it wasn't a threat if, when somebody walks into Martha O'Brien and they see Maven, that they think that's a Martha O'Brien staff person. That's absolutely fine. She needs to be seen as a Martha O'Brien staff person. It makes Martha O'Brien stronger. We all kind of thought we would start functioning sort of like Intel on the inside. Doesn't matter what label's on the computer as long as what's in there is working really well. That's a big deal when you start realizing we're also all talking to the same funders for funding. We're writing the same proposals at the same time. But we really had to move past that. And also, we're then really sharing a lot of data across programs. Who you're impacting, I'm impacting. So I'm claiming that. Who I'm impacting, you're impacting. You're claiming that. So it really does mix all of that up some. All right. So for us, in doing this, the pieces really came together. Hang on. I'm turning 50 and I'm having a harder time. Wait a second. This is where a cute slide deck is not helpful if you can't read it. Okay, so we put those pieces together, and we were bringing the clinical service, impact on trauma and functioning. Martha O'Brien was bringing expertise in the parent empowerment, educational concerns. Nurses for Newborns, early parenting, child development, health concerns. And what we realized was really we all had a need to make sure we were covering our bases around child abuse prevention. It was nothing that we had explored in the process and realized we needed to pull that in really early. And then finally, Conexión Americas with their cultural competency and particularly their attention to refugee populations. This was a huge deal for us because we had just merged with Health Assist Tennessee, doing a lot of language service work. And as we were doing more and more healthcare outreach, we were realizing the importance of those very issues that Conexión was bringing to the table. And so it was a huge benefit to our staff. And all of this was built around that shared operation and shared philosophies model. These are core parts of the presentation that we did for Collaboration College. And I think you'll end up still doing 2 presentations. Is that?
Only 2.
Only 2, right. So you'll do one and you'll get feedback and there'll be finalists from that, and then you'll do it again. And I would say use this as a process to really think through what you're going to do. If your presentation flows, then your work is likely to flow. So when we thought about impact and we thought about the work we were going to do, we decided that we had to be able to see the impact in the community and we had to be able to see the impact in the families. So what we did in the presentation was we talked about one family and how we would work with them. And what I'd like is if each of you can talk about how collectively the collaboration has benefited a family that you guys have worked with in your communities. Tara, do you mind starting?
Sure. So we know that if it was a family like this, so we'll imagine that it's immigrant parents, a daughter who was maybe born here, and then her son who was also born here. So with a family like this, they might come to an organization like Conexión Americas, either seeking out our parent classes, seeking out our ESL programming, and we would know that we could certainly refer them to the counseling options that the Family Children Service counselors who are bilingual and bicultural, which were 2 needs that weren't met very well at all before this collaboration in our community, that they could go to those counselors, that they wouldn't have to worry about their immigration status, that they wouldn't have to have TIN care or be able to pay for that service. And we would know that, especially with the mom with a young baby, that we could refer them to our partners at Martha O'Brien or at Nurses for Newborns for needs that they could meet.
I think if Cheryl were here, she could tell you many, many stories about her work, especially with nurses, around how that collaboration worked. But the one that springs to mind for me is one that the therapist who's placed at Martha O'Brien did. And actually, that work took her to Stratford High School. We did not have staff equipped to deal with those issues that happen to kids and why they're not showing up to school. And literally, I remember her talking about trailing a young man all day long, literally going outside the building, following him outside, sitting and waiting patiently. Eventually, by the end of the day, this young man responded, saw her as a safe place, and that connection was made. You just have to have a professional to make that happen, and that was such a blessing of the partnership.
As you may have guessed, it did work, and we did get counselors for each of our agencies so that we all have a counselor that is an employee of Family and Children's Services, but with job descriptions, we all wrote together that we interviewed the people together, and it is truly a joint, not somebody just placed in our facility. And we were very blessed to have Frankie, who goes out and sees our families, and there are so many stories that I could give, but one that we recently had is a very sad case that we had with a baby born premature. It was mom's 4th or 5th baby, but we really got the referral because mom was diagnosed with cancer, and her health was impacted. And so Frankie originally started going to counsel the mom on working through being a parent and having this terrible diagnosis and care. Unfortunately, this mother passed away about 2 months ago. So it went from counseling mom to counseling a 20-year-old who is now supporting his family and working through and almost got evicted. And it's a Latino family, so we have talked to Conexión about resources to be able to help. We've talked about bringing in the parenting and teaching our young man to, but the counselor and that impact. And this is just one family that truly touched all three of our partner agencies. And, right now they're doing as good as a family in that awful situation could be of a 20-year-old with 4 children to raise. So, impressed.
And I think a step beyond the clinical staff helping is that we understand better how to navigate Stratford High School in the community. So it's made us stronger. Conexión understands more that with that family right there, the losses and things they experienced before they got here are part of what makes their journey harder now that they are here. So even if barriers are knocked down, there are perceived barriers and perceived concerns or real concerns that have to be addressed. And the same is true we understand neonatal issues, and we're so much stronger in looking at the role of parents and the need for parents and the need for parent engagement, even though it was all stuff, those were boxes we would check on grant applications. But it's much more in real life, and that has made a big difference. The other thing that we've done is quarterly, we are each doing trainings for each other. So we've launched the Brazelton Touchpoints curriculum. We have done the full curriculum for folks, and then we realized, really what a lot of our people need is an overview. And so we developed an overview training. We've done the child abuse prevention training and child development training. We've done the cultural competency training. We're moving that into Islamic and Kurdish cultures. And today, thank you, Vicki. And so we have staff, and our staff come together to do that training together. Then they look at the application internally to their agencies, and then they share how could we leverage the supports of each other to meet the needs in regard to what this training was. So we've been very intentional about this, and that's honestly what we use the money for. We did not use the prize money to pay anyone's salary. We have spread that money out over 3 years to cover the cost of training and build capacity. And we're in year 3, and we're finishing up the final $4,000 of that money. We've held it in a reserved account and used it throughout the time. So we saw it as a real investment and building foundation. So we felt like we were going to win, because when we went in that presentation room, we had already had a lot of successes. We had done some important things before that final presentation. We'd already talked to funders. There was a real buzz about collaboration at the time, and HCA and BHT, they were into it, and so we decided to seize that opportunity, and they actually funded the clinical positions that are now working with us across all the agencies. So we'd already approached funders. We'd co-written grants together. We'd already begun cross-training staff. We decided we're going to do this anyway. We think it's the right thing to do. We knew about each other's events. We were promoting events. We were supporting each other that way. Part of our process and what we used our consultants for were to develop the job descriptions and what the MOUs would look like, because we knew we needed those. We didn't want to win it and then say, okay, well, now we need to spend 4 months figuring out how to do it. We wanted to be able to start at that point. And then we learned a lot about what does not work about co-location. The other thing we used our consultants for was they interviewed about 15 staff across our agencies who were already co-located to find out when did it work and when did it not work. And what we found out was more often than not, it really didn't work. They were just doing their work somewhere else, but they weren't making that place stronger. And importantly for me, since it was going to be our staff, that experience wasn't making our staff stronger. And so this had to make us all come out in the end at a better place than where we started.
Michael, can I add one thing to that? Kate Monahan through CNN was the consultant that worked on that, and there is a paper on co-location that people may want to take a look at and see. But there's also certain personalities. There are people that are great at being co-locators, and there are people that it's going to be wrong. And so it's not only setting up the job descriptions, but picking the right person. And Kate did a great job of looking at people who were co-located and it worked, or looking at agency supervisors and what their thoughts were. So I think we should let you know that that is available if you want to look at a co-location piece.
Great. And so at the agency level now, looking back 2 years, these are the things we feel like we've achieved, that we have figured out a way to write doable outcomes. I mean, I have been struggling with that. Our agency has about 20 program areas, and we wanted some way to capture all of our work. So we've been struggling with that internally. Now we've struggled with it across 4 agencies. How do we develop outcomes that make sense across those agencies? We realized the importance in revising outcomes. We sat down with Joanne and Kristen and Kathy and said, what we thought wasn't what happened. You know, what we thought was going to happen was we were going to do really long-term work at Martha O'Brien, and we were going to do really short-term, get people through the crisis of having the baby at Nurses for Newborns. It was the exact opposite. The folks at Martha O'Brien were experiencing such rapid change and rapid trauma and loss in their life that it was much more, I need to figure out how to get through next week. And so we needed to figure out a way to measure and do our work there and allow that person could come back, but not think that that was one experience with that person coming back 4 times over 7 months. Then what we needed to do at Nurses for Newborns was realize, you know what, the family that we're working with, their isolation is not going to change drastically just because a baby gets better. They really need this relationship. And the other thing that we discovered was the traditional models for counseling don't work for everybody. You know, going in, seeing someone every 2 weeks for a 30-minute session is not necessarily what's going to work for everyone. And so we really, after the first year of funding for the clinical positions, we revised those outcomes. And we, Kristen may be reading our 6-month update right now for BHT, but because it was due the other day. But we made all of those outcomes. We made the measures make sense, and it made sense for the people we're working with. And so we're really excited about that, because at first we were like, well, gosh, but you don't know what you don't know. And you don't not move forward just because you don't know. You just move forward cautiously with great friends, and that's what we did. We've also really developed an evolving community of folks that think like we think. I think all the agencies think about trauma differently. We all think about cultural competency differently. That it's not just a buzzword, it really is who you are and how you are and what you do on a daily basis. We all understand poverty in a different way. In relation to poverty, one of the things we understood was that we didn't understand it as well. And we've tweaked the training for this next year to move from just doing trauma-informed care training to look deeper at the impact of poverty and how that has very similar effects on decisions people make and things that people do. So then we also felt like that there were organizational and community impacts. One of the things, and when you do your presentation, you'll have very discrete things you need to put in your presentation, like a budget. We took that out of this. But I will tell you that if we look at the cost savings across all the agencies, both for the training, not just that we got the training funding, but how we did it, and then what we leveraged, and then also the counseling supports. This 3-year project saved the community approaching $400,000. And we feel like we're a lot stronger because of that. And if you can tell that story, that's helpful too, because everybody's competing for the same dollars. So you need to be able to show that there was a cost impact. The other thing that we're hoping to do is to show, particularly with the counseling, that because none of the counseling the way we do it is funded with third-party payers. We'd like to be able to take the model and have those conversations with, if not the payers, some of the foundations that the payers have, to say, look, you need to invest in this one way or the other, because we're seeing your very people, we're not billing you for it, and we can't bill you for it because the way it ought to be done, you don't pay for. And I think we are able to be bold enough now to say that because we know it really does work. Okay, so the things that we've learned that you need to be flexible throughout the process, that communication is really crucial, that it isn't just about co-locating somebody, it is really about embedding them in that community. And for us, that is just describe how the hiring process goes for the counseling staff. We screen people for clinical skills, and then we send them over there and we say, you pick who you want. You know, we're not going to send you anybody we couldn't work with. And, you know, sometimes it's exactly the person we would pick. Other time it's not. And what we know is they need to work in that setting more than they need to work in our setting. And so it needs to fit. It needs to fit for them. And then the other thing, and Renata added this from Conexión, and I'm going to fast forward so we can do some questions. The other thing that we figured out was somebody had to kind of lead the charge. And I think for us, just mainly because we had some resources that other agencies didn't have, and having a training person, Family and Children's kind of took that role in leading the charge. We also were the fiduciary for the funding that we got and all of that. And that's fine. Just somebody needs to do it, and then you need, again, to whatever you're doing it for the collective good, not just for yourself. The greatest learning of this was the things that we figured out were necessary for collaboration to be successful. One was reciprocity. Anything that's good for me, I need to make sure is good for you. And that we need to be looking at transformative change and letting go of how we might have done things before. I think all of us did that in the hiring process, and also in how we approach and talk to funders. Then you have to be able to adapt all along. And finally, you have to trust your partners. I mean, these folks we have each other's budgets, we have each other's data, we know each other's needs at any given time, and we try to be responsive to them. But that's also showing each other all your weaknesses. And so we have to really be comfortable doing that. And it was an amazing group of people who made that very, very much possible. And then lastly, you know, I believe that if you want to go someplace quickly, do it by yourself. It's a lot easier. But if you want to go someplace far and go deep, you're better to go together, because then you're not alone when you get to the end of the road. So that's what we've learned, and that's what we did, and now we're kind of here just to answer questions.
So what I heard was that you all, as a leadership team, kind of came together and planned. Hello. What I heard is that you all came together as the leadership team through this collaboration college and did most of the planning, but then you passed it off to your staff to actually implement. Can you talk about that process and the buy-in?
Yeah, and I'll throw this out and then I'll let you guys do it. One of the things we learned, I skipped that sign, but one of the two major things we learned was that we needed to involve them even earlier. That would have been really helpful, particularly because so much of our transformation was about the training. We weren't doing it; it was our staff who was doing it. So that getting them involved that way, and that it wasn't just one thing, that it was this co-location of clinical staff, so we had folks living and being on other people's teams full time, but then there was also this kind of philosophical undergirding that was going on. So it was a coming together at two levels.
Mm-hmm. And I think for us, like, we don't have social workers on staff. We are not like counselors by nature. And so even just thinking about the trainings that the Family Children Service counselors provided to our staff, they're not the kinds of things that we really would have sought out for our staff at any point in time. And we've really been able to see, I think Christine was the one that named it as this, each other as VIP partners. And so if my colleagues who do college access work have a question or thinking about starting a new college access program, which we just did, Martha O'Brien is absolutely the first agency in town that we think of, and the same can be said for the other two agencies as well.
You know, this has always felt like a bit of a marriage. And that sounds kind of weird, but it is really that kind of emotional connection that I have with the other partners. And so it is that I take back to my agency with me. And I feel it's my responsibility, and we're not going to be successful unless I ensure that everybody else at the agency can come on board in that way, and that's from the top all the way down. It doesn't work just for me to be in love with these folks. everybody has to understand why this is a good thing. And so it requires that taking time, not only the time that we spent together, which was a year, and that's a lot of time, and sometimes it seems like so much time, but I guarantee you we wouldn't be where we were had we not done it. It was time, very well invested. And you have to then take that same approach back to your agencies and ensure that as these things, because it's very flexible, it's very fluid, why should I show up at a training across town? That's my responsibility to ensure that this partnership stays healthy because I am communicating with the rest.
And early on, the first thing we did was the trauma-informed care training. And in that month, we did that training twice, or maybe it was 3 times. And we trained over 150 people across our 4 agencies. It was really important to us that we start really deep and with something that was so foundational. And that was a way to bring those staff together. And we made sure that all the co-located people were at that first training so that they were really the glue that kind of went in and kept things going at each of the hosting agencies.
I think the Collaboration College is a process, and I think it needs to be looked at as a process that evolves and changes over time. So at the beginning, I think we needed to be just the leadership group because we needed to see, did we have matches or not? And did we buy in and to build the trust there? And then as we evolved, because what we started out day one, the day you're having today, and what we ended up with was different and had different foundations. And so we did spend a lot of time together that first year, but that built a foundation and a trust that started. And then as it became appropriate going down, I think it would have been beneficial to get some of the other folks in. But now that we do our training, it's across the board with all of our staff. And that's a great blend to be able to do that piece.
And it's not just your staff, it's also your boards. I had a board member who called me and said, hey, I met our person at Conexión. I forgot we had somebody there. And, and they were about 10 minutes into a conversation before this board member realized that was a staff from Family and Children's where he's also on the board. And so it was, and that was neat that it was that person was that enmeshed in that community that it didn't matter. And then, the board kind of talked about, we need to think about that when we talk about our work, we're not talking about our work here, off of Elliston Place. We're talking about our work in all these places. And that is really what I think makes the city stronger. Yes.
I'm Trish Christ, and I run NECAT, which is Nashville Education. Thank you, Joanna. Sorry. I'm Trish Christ, and I run NECAT, which is Nashville Education, Community, and Arts Television. And I'm so impressed with what you 4 entities have done, and I sort of have an offer for you. If you're ready to tell more people in the community that you could serve about this collaborative impact you're having, our 3 television channels are exactly for this very purpose, to tell viewers what you guys, the doers, are doing for them. Let them know about your services. I say this specifically to you and generally to anybody in the room. If you have existing footage about the mission of your entity, I want it from my channels and I will broadcast it. If you have a PSA that you want to put out to say, hey, Family in Trouble, look at what you can do, with our 4 partnerships here. And if you don't have footage, come take our classes, learn how to do it. We'll help you make your own PSAs, ongoing television shows, etc. And just let me help you get the word out to more people about the work you do.
Great. Thanks. Yes, ma'am.
I'll wait for Joanne.
Yell really loud.
She can do it.
Good morning, Dr. Kimberly White-Shethridge. And I had a question about just the collaboration kind of at the next level and whether or not you guys have been involved in that. So if all 3 of you were to disappear, say tomorrow, kind of what are the skills in collaboration have you managed to teach the community, the participants of who are receiving these services, as far as kind of long-term community transformation and the flexibility, the adaptability, the reciprocity, which I can't say, and all of these things that are so important for organizations to work together. how are we working to transfer that to the community so that once the funds disappear, the organizations disappear, those skills are there for the community to be able to move itself?
I think, and then I'll let my colleagues respond. For us, our major across the agency outcome measurement is increased connectivity. That folks are stronger if they're more connected and if they know how to get connected. That a lot of times when people come to us, they come to us needing us to knit those connections together for them. And if what we can do is show them how to do that, then they can practice it with us, then they can do it without us. We kind of had to do that ourselves. We had to knit that connectivity together through the collaboration. So I think that my hope is that folks who come to all the agencies, all of our individual clients are developing a common skill, which is that they are knowing how to ask questions, knowing how to ask for help, knowing how to seek out assistance, but also knowing how to ask people to help them seek it out, because that's all part of that process. So what about you guys?
I agree completely. I mean, I think at a place like Casa Safran, we see that every day, that people feel connected and they find lots of ways to build connections that they didn't realize that they were going to need or want when they come in the door. I would just completely echo what you said, and then also add that we've seen a difference in the population that we work with, that they're also willing to advocate to others that it's okay to get mental health assistance and that is an okay thing, it's available in this country, and reducing some of those barriers and stigma.
Right. I also think, particularly in the area of counseling, if you bring it into an environment that isn't a counseling environment, a lot of the stigma goes away. You know, we also, the other reason our model doesn't work for third-party payment is we don't diagnose anybody. So, you know, you're just getting help because you need help right now. It doesn't really matter what this is going to be called. And that is also helpful because all of our clients have already gotten labels. They're already living places that give them labels. They've experienced things that have given them labels. Their emotional health needs do not need to create another label. And so we try really hard not to do that as well.
I just echo what Tara said. Even though you put a resource in a community doesn't mean that community is going to latch on to that. And that was part of what we learned. What we thought the community was going to respond to wasn't going to happen overnight. In fact, it was going to take, it is a process like everything else. That understanding that mental health is something that can be for me. The other thing I think I would add, because I don't want this to get lost, is that we really are growing this community of practitioners. And that means that as we build capacity in those that are providing the service, the how of it becomes stronger, no matter which piece it is that we are providing. And that simply works exponentially because nobody ever stays at the same agency for 20 years except for maybe me. And so when they move with this knowledge, they move with this expertise, and hopefully they take that and they voice that and they apply that in their new environment as well. So I think it is not just the typical customer that we think of coming through the door that is learning new skills, but the staff and our partnerships are learning the kind of skills that make our agency stronger, and as they leave and go off, they're making those agencies stronger as well.
I would just add too that piece of collaboration, like I can name specific people that I'm thinking of who have left one of our agencies, and now I will see them out in the community at your agencies, and it still feels like we're collaborative partners. That's how strong the relationships between our staff and our agencies have been.
I think we have one more question,
Okay.
and this will be the last one.
Mary Lyndon Salter with TADIS. I'm curious if you all have a case management system within your agencies or a shared medical record, and if you don't, would you do that if you could?
I think if we scaled this beyond what we've got now, we would. The way it works now with Martha O'Brien and with with Connexion, we have our records, and because they're not really a social service or a mental health service providing agency. Martha O'Brien does have a consolidated record system, but I think all that's in yours is the referral to us, and then we have ours. Nurses for Newborns, we document in their record. And so it is really what works for the agency. I think that would be great. I think that that's a huge infrastructure. It's almost like it would be great if somebody would decide that all of Nashville be on. I mean, if we're going to really measure outcomes, I'd love to throw this out to the community. If the community would fund all the agencies getting on one way of tracking, then we could all get on board to do that. And you can still track your own individual, what that outcome means for you. But it becomes really hard when one is not a mental health agency, another is a hybrid, another is actually a prevention agency that's dressed up like a healthcare agency. And then there's us. So it's what we've done is adapted to the settings that we're in.
But we did agree on measurements on the front end.
Yes.
So even though we may do it a different way, we have measurements that we knew from the very beginning were things we wanted
And we
to measure.
agreed about how we would document. So we knew for Vicki, we would put information directly in her system. You know, we knew what we would do at CASA, and we knew what we would do at Martha O'Brien.
Well, please join me in thanking them for that wonderful perspective. You can certainly see why that was a winning combination for us in 2012. Hopefully that's starting to generate some ideas for you. Good. We are going to move into talking a little bit. I'm going to put you to work because I thought we were about to fall asleep, Mr. Cameraman. So we're about to just have a good time walking all the way around here. I would like to share with you a little bit about the program and begin to help you think about ways you might want to move towards a collaboration for this year or for a collective impact project. And so we're going to spend some time and some interaction and some dialogue about what all of this is. And so that is perfect. If it can go back to, no, you had the right one. That's correct. Thank you. So if you look on your program, we really tried to put together a program piece that could help you pass this event. One, if you look under the various tabs, you have the program, but we also put descriptions about different organizations that are participating today. So if you hear in this program, in today's activities, you hear something that triggers a thought, you know a little bit about that organization, you know who you could follow up with afterwards and engage in further dialogue, right? Additionally, we've given you under the 2.0 Challenge tab additional information that we cover this afternoon on what are the specifics, how's this going to work. But this is a piece you can go back and refer to as well. Under the speaker tab, you'll find bios, so if you have a question for one of our speakers, you could always use that as a follow-up piece and to be able to reach out to them. And the big piece is probably under the resource tab, the 3 articles that we recommended and that are guiding Collaboration College's efforts for this year. So those are in this binder for you as well. So hopefully a piece that you can use. I direct your attention to the line that's on the front cover. It says this: Collaboration College is a year-long, so you're here for one day today, and you may choose to apply to continue, and if so, it'll be a year-long process like what they just described for you, okay? So it's a year-long opportunity for nonprofit organizations as well as public and private partners. We're going to talk about that because that's a change from 2012, okay? In 2012, everybody had to be a nonprofit in order to play. Now we're saying we'd love for you to think about how do you partner with businesses? How do you partner with government to move towards collective impact? So we're going to really talk about that. They are working together to benefit by combining their representative or respective strengths to create community good and to learn, practice, and be supported in that effort. So you'll find there's a great deal of resource in this room that as people move towards collaborations and towards collective impact projects, that there are going to be consultants that will be able to help walk alongside you and help build your capacity to do what you aspire to do, okay? So that's a little bit about how that's going to work. We'll unpack it throughout the day and especially at 2:30. Somewhere is a slide clicker.
Oh, it's on the podium.
Well, thanks. I'm just kidding. I tried to make it sound like it was his fault. I probably should have known that. So when you think about going back to college, if I said to everybody today, guess what? You're going to go back to college. What's the first word that comes to your mind? Woo-hoo and yay? I thought for sure I might hear beer, and I'm grateful that you refrained from that comment on this campus, right? So what else? If you had to go back to college today, and that's what I work with, are adult learners who don't have college degrees that are thinking about coming back to college, what would you think?
Money.
Oh, it is going to cost a lot. Okay? Promise. Oh, if I go, there's a promise of something great on the other side. Time, someone said, it's going to be a huge time commitment. What if I don't have enough time? How do I balance that with everything else in my life going on right now? What else? Oh, we're going to have tests. Like somebody's going to have to check to make sure whether or not I'm doing what I say I'm doing and I know what I say I know. Good. All the different people you're going to meet. So there's Miss Social over there. She's like, woohoo, I can hardly wait to meet all these new people. Yes?
A great opportunity to take risks.
It's a great opportunity to take risks, right? So when we go to college, we can do things that we might not normally do, right? It's a fresh start in a way to be able to be a little riskier than you might normally. What else? What did you say? Oh, he's not going to tell me. Okay, that's all right. She kind of blushed, so maybe I shouldn't push. So when you think about, oh, you make her blush all the time. That's good. So when you think about going back to college or participating in collaboration college, you might have some of those same kind of reactions. Oh my, this is going to take a ton of time. We already have so much going on at the agency. How can I take on one more collective impact project, one more collaboration? Or, oh my, I'm going to get to meet all these new people. I could partner with people I never even thought about partnering with. Or, this might actually cost me a lot of money, and $25,000 may or may not be mine, and I might have a lot invested. Wonder if I'm going to get the promise of something different at the end, right? We're very deliberate when we chose the word college because it is intentionally about college. It's about going back and learning something, building a skill set that you did not have or you don't have as fully developed as you would like, or even enhancing something that's already a strength. It's about intentional learning, and we hope that's what you're going to engage in not only today, but over the duration of the year-long project. How many, if I ask you, and we'll ask Joanne and Kathy to close their eyes, but how many of you came today because you're hoping like $25,000 could be really helpful? Oh, thank you for the one honest person, right? So for a lot of us, the thought of being able to have that kind of money to be able to help seed an idea or a project is really attractive and appealing. I hope some of you chose to come because you really needed the enhanced learning. You really needed something else that could help drive the kinds of projects that you're hoping to accomplish within your organization. So we want you to see this not just as a competition, but truly about deliberate learning. All of us have spent a great deal of time thinking about your panels, thinking about the perspectives that would be shared, thinking about the learning that would come out of today, but also beginning to anticipate that the learning that will come in Collaboration 201 as well. So we want you to know that's really important. Because I'm a faculty member, I love to give homework. Chris, right, in the back of the room back there, when I came in this morning, Chris is back there frantically cramming for class today. He was reading his articles just as happy and fast as he could, and I said, Chris, all you got to do is highlight a few things. It doesn't even matter what it is, and your faculty member will think you read it, right? He was like, And then I introduced myself and said, now you're busted. But anyway, so I had to make it complete, Chris, by calling you out right in front of everybody. But at least you were trying to read it, and I do appreciate that. We really spent a lot of time picking the 3 articles that are in the back of your program materials for today. I hope you took the opportunity to read them. If you did not, I encourage you to do so, because I think they are chock full of wonderful ideas and suggestions that can already begin to help you. We also ask you to complete an online survey. I'd like to say about 65 out of the 165 registered took the opportunity to complete that online survey, so we do appreciate the 1/3 of you who did your homework. We're trying not to take it personally at all. But anyway, so I think because I knew that you wouldn't do it, we should do a pop quiz. So can you go ahead and pass out those quizzes for every... No, I'm just kidding. I wouldn't do that today. But don't you hate that feeling? My child came home and said, my teacher, she was mean today. She gave a pop exam. I said, a pop exam? She goes, yeah, it's worse than a pop quiz. It was really long. And I thought, I've never heard of a pop exam. But anyway, my middle schooler thought it was pretty horrible. So no pop quiz. But maybe we can talk through how we define collaboration. Many of you had some really great answers in your survey to how we define collaboration. You used words like working together. Of those 60 of you that completed, thank you so much, of those 60 that completed the survey, almost half started their definition with working together, blah, 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 right? Working together with other organizations too. Working together, blah, blah, blah. Okay, so you got the part about the working together. Many of you also articulated in your definitions that there's a common goal. There's something that you're all working together towards achieving, and I think that's part of that collaboration definition. Many of you identified that to you, collaboration was about the effective use of your resources, and that's true. Collaboration College, really when we started in 2009, and we did a project with Joanne and C&M called Collaborate for a Cause. It was about how do we stretch our resources in a somewhat tight economic time? How can we collaborate around some common good so that we can be more efficient, better stewards of our resources, right? And then certainly when we did Collaboration College last time, 2 years ago, that was certainly a theme. And most of you identified it's about having greater impact. Seeing that individually as your organization, you would have a lot better or much broader impact if you worked with others to try to achieve your goal. And so many of you identified that. This is the definition that's kind of the approved definition. I'm not sure it's approved for Collaboration College, but it's my approved definition. So, hey, I get to present, so this is what I'm putting up. It's a cooperative arrangement. When you cooperate with somebody, it's different than working together, right? We can work together and be really nasty and just be stuck in a collaboration that we don't like. But we're cooperatively working with one another, right? Sometimes collaboration is not easy. Conflict will arise, right? Somebody gets on your nerves, they start to irritate you, they're trying to push an agenda that doesn't seem to be supporting the common goal that you had. And so here it's about cooperation, about being able to both be in some sort of a cooperative arrangement. 2 or more parties, you may not have known each other prior to starting the engagement. When we looked at several surveys, many, I'd say about 10 to 15 people said, I'm coming to Collaboration College 101 because I'd like to find a partner. I'd like to find somebody wrote that I could merge my organization with that would have a common mission and vision. Others wrote, I'm looking for somebody who would be really interested in education, or I'm looking for a partner on this particular topic. So many of you are coming because you don't know who you want to partner with, and you're hoping that the answer exists in this room. That at least the organization is here, or somebody who can connect you to the right organization is here. And so you may or may not have ever worked with that person before or that organization, but you're going to work jointly towards a common goal. okay? And so that's a definition around collaboration. You had the article, which is really based on the Collaboration Prize, which initially is what was our thinking behind Collaboration College. And it identified 8 different kinds of models of collaboration. To tell you the little backstory on that, in 2011, when we began talking about collaboration, we felt like the nonprofit community thought collaboration was about merger. And we wanted you to understand that it isn't just, though that's one form, it isn't just about merger. There's all kinds of amazing ways in which you can collaborate with other organizations. And so as a result, you'll see the descriptions of those 8 kinds of other collaborations that have been recognized among nonprofits. And so I encourage you to take a look. This is not a prescribed, we will only look at one fully integrated merger. We will only look at one partially integrated. We only want one joint. It's not like that. But these are, again, things to get you thinking, to help you think about what might be a possibility, what might we be interested in doing, and to provide you that kind of framework. I really hope that you won't see this as what we are prescribing or preferring. There's just this definition to help build your ideas around models. Many of you, we asked the question in the survey, do you have an idea right now? And almost all of you wrote, good question. And then you began to, which thank you very much, Caitlin, for that good question, wherever she is. But you began to describe what it is you would really like to be able to do. If you could find somebody else who would be interested in working with you on that common good or that common cause or mission, okay? So many of you came already with an idea. When we ask you to flesh it out fuller, man, there are some big honking paragraphs. You've got a lot going on up there. Many of you already have those ideas, but if you don't and you're open to other suggestions, please know that the people around you, people you can have conversation with over lunch, may contain some of those ideas to help give you ideas around the models of collaboration you might want to look at. When we looked at collective impact, going back, and Joanne or others feel free to chime in, we really felt like the collaboration is great, and we saw a lot of great things happen, but we had a requirement that you had to be a nonprofit in order to participate, and you couldn't really partner with a government entity or a for-profit business. And we wanted to think about how could we move towards this broader vision of collective impact. How could we really begin to think, if we all aligned, who is all to be defined, right? If we could all, some group of actors, as it says up there, if we could all align around, we want to reduce homelessness. We want to do X, Y, Z. Look at what we can do. I was speaking at a conference in Boston yesterday, and I shared a cab with 2 ladies who turned out to be legislators from the Vermont State Legislature. And I said, what is the most pressing thing facing you in Vermont? And she said homelessness, which is great because she was going to an education conference. So I would have preferred it was education. No, I'm just kidding. But anyway, homelessness was her issue. And she said, we have all these individual organizations in Vermont working on homelessness, but we are still writing $50 vouchers to go to a hotel for the night. And if we could just think about this in a different way. And I said, hey, have you thought about collective impact initiatives? And began to share with her some of the readings that you have, or share with them some of the readings that you have as well. So again, it's taking all these folks that are already working on common issues and saying, man, if we can move in a direction in which we are all committed to a common goal, to where we can coordinate our efforts, it would be amazing at the change that we could see happen in our own community. I love both of these readings, and as I said to Chris, hi Chris, how are you? And as I said to Chris, I think the tables are some of the best parts of those readings. So if you were pulling out your yellow highlighter moment, the tables that talk about the 3 conditions that need to be present, the various stages of collective impact, if you look at these 5 conditions of collective impact, I would just point these out. So under common agenda, it's really about, do we share, who do I share a vision with for the change I would like to see happen? Who in this city shares that common vision? It could be faith-based communities, it could be a government entity, it could be a business that's really committed to that. Who do I share that common vision with? Under shared measurement, everybody has to agree on how you're going to measure success, right? If each organization measures their success differently, well, you can't really get the combined effort of the whole, right? We all have to align around a common set of measures. Best example I could give you is that we just decided to go transparent in our measurements between colleges here at Lipscomb. So we are all going to be measured on the same things, and all of our results are going to post so every other dean can see exactly what every other college is doing. How do you think we like that? I don't like that very much unless I think mine is the best, and then that's pretty good because then I can say, well, they're not performing, right? And that's where the challenge around this point too, we have to agree to a shared measurement. We have to be able to say, you know what? We're going to be transparent. We're going to agree to these common ways that we're going to measure success, and we're going to all work towards that and be able to report it and share it openly. Under third, you have to be able to mutually reinforce your activities. So if you're planning an advocacy campaign and they're doing another activity or program, are they all mutually reinforcing what's your common shared vision? If they are, that's great. So how do we get them to work together? Under 4, continuous communication. It's not about, here, let's get together once a quarter, or let's get together once a year and review our numbers. It's about us continuously saying, man, here's who I talked to, and I found this challenge. Have you found a way in which you could do that? Tell me how you approach this. It's this frequent and structured communication around that common idea, that common goal that you have in mind. And for collective impact to work, you really need a backbone organization to provide that support. And those typically are independent entities that you have created, that you fund appropriately, and they had some real good suggestions about how much funding you need, but that you fund appropriately, a staff that's dedicated to making sure all the players are continuing to advance on those other 4 issues, right? So when we looked at your survey, 83% of you said, I understand collaboration. That's not a problem for me. I got that one. But 40% of you said, I don't really know much about this collective impact thing. And if that's you, I really encourage you to read the articles, to dig into the literature around collective impact, and to begin to think about how can we in our organization make a difference? Who do I share a common agenda with? Who might I be able to work with and get those conversations started within your organization? Be the leader. Go make that happen to get that advanced. So as I said, we've really looked from collaboration to collective impact in our thinking. But let me say, collaborations are valued just as much as collective impacts, not one over the other, but really trying to open up depending on where you're at in the spectrum. So we think about those that attended Collaboration College 101 2 or 3 years ago. You may find yourself moving much further down a collective impact project, where others may see themselves at a collaboration. That is, we are not, again, trying to say we want so much of this and so much of that. We're really just trying to respond to where you are and what you need and what our community needs, okay? So under the last one, I think I pretty much gave you keep calm, take our survey. I don't know. I think I pretty much gave you the big highlights, but I'll tell you what else I had written down. Woohoo, looking for my notes. Don't you love it when you're, I said that one already. That was good. Said that one already. That was good. When we look at the big key things that you hope to get, I want to find partners today. That's a pretty lofty goal for 101, just to let you know. I hope I walk away today with the partners that I'm going to work with. But we are going to give you some time this afternoon in that 2:30 to 3:30 block. We'll be doing a kind of a pre-assessment, a readiness test to see how are you. We're going to be grouping those by the kinds of collaborations that you might be interested in. And Karen's going to be leading that initiative for us this afternoon. But that'll give you that opportunity. Many of you say, I just want some strategies, some tools, some ideas that will help enhance what I do. And I hope that you'll feel that way, that you've gotten that by the end of today as well. So that gives you, I think, a little overview of where we're heading.